of the patient. So if you have somebody that's young, especially somebody that's young and female, for example, you're more than likely looking at anxiety. That's most common, or PVCs or PACs, something that's fairly benign. But with that being said, the caveat is that you always have to look for the big stuff. So what are the big things in somebody young? So obviously, always looking for things like Brugadas, Brugada, always looking for things like HOCM, hypertrophic obstructive cardiomyopathy, always looking for prolonged QT, always looking for a delta wave, because a delta wave could mean they have Wolff-Parkinson's White. And we're also, even in young people, looking for VTAC or AFib, especially the AFib if they drink a lot of caffeine or if they have sleep apnea. And yeah, believe it or not, young people can have ventricular tachycardia. So patient comes in, what am I looking at? First thing I want to know is how often they feel the symptoms. And when they feel the symptoms, what exactly are they feeling? A lot of people will describe feeling like their heart is pounding out of their chest. A lot of people will say it feels like it's flip-flopping. And all of these things are very important because it helps you hone in. If somebody complains of anxiety, for example, I always ask, how long does your anxiety last? If they say anything under than a few minutes, you always have to kind of wonder, especially if it wasn't provoked by something that would create anxiety, you always have to think about an arrhythmia, especially something like PVCs or a pause, or even something worse like VTAC. Now, one of the first things I'm going to want to do is get some data. So I want to look at lab values. Specifically, if it hasn't been ordered, I want to get a magnesium. And I also want to, later on, as long as they don't have any diarrheal illnesses or any IBS or any kidney failure, I'm probably going to start them on some magnesium, usually magnesium oxide, 400 milligrams QHS. And it's helpful for not only palpitations and calming the cellular membrane, especially if someone who has frequent PVCs, but it's super helpful even with patients who have AFib. So magnesium helps with anxiety, magnesium helps with sleep, and it also helps patients who are constipated. So this can sort of be a trifecta type winner, magnesium, but it's always something to check in the lab values as well. Now, also you want to look at getting a Holter monitor on them. A lot of people call these halter monitors, probably because they look like the shirts that are halters, but these are actually Holter monitors. And a Holter monitor is a wearable device that they can wear under their clothes for anywhere from 24 to basically 30 days. Usually in our office, we will put on a 24 or 48, even a 72 sometimes in the office and have them come back for us to take them off. If they're any longer, usually we'll have the patient do what's called an event monitor, and that's where they'll wear it longer, and that'll be sent in by a company. There's also different patches patients can wear, like a Zio patch, etc., that are a little less irritating to the skin. But with a 24-hour monitor, they have to keep the monitor in place, and sometimes that can be annoying to patients. The other thing is I want to know is, once I've got the Holter monitor ordered, I want to look at it, and I want to look at specifically when they press the button, when their symptoms are, because if their symptoms, hopefully they've gotten a screenshot of what's going on and I can see, is it something to worry about or not? The next thing I want to do is I want to get an echocardiogram, because I want to make sure that they don't have any atrial enlargement. If they do, then I'm most likely worried about an atrial fibrillation, because with people with left atrial enlargement, or right atrial enlargement for that matter, they are more predisposed to AFib. And then I'm thinking about treating them in the meantime symptomatically. So you always have to assess risk versus benefit. How much is this really affecting my patient? If it's affecting them a lot, I may consider putting them on a beta blocker, especially if they're hypertensive. So then again, it's sort of a double win. I'm always looking for things that can kill one bird, kill two stones. Not that we should be talking about killing stones when we talk about patients, but anyway, you get the drift. And also I'm thinking about, can I use an antiarrhythmic drug? For example, Sotalol. But with the antiarrhythmics, they're always a little bit pro-arrhythmic, so you always have to worry about them causing an arrhythmia as well. So as good as they are at controlling arrhythmias, they're sort of also as bad. And some of them can prolong QT. And QT is bad to prolong, because if you do that, they are more at risk for something called torsades, which can be lethal. So always thinking about these things. And finally, I want to look for, is there any chamber enlargement? I want to look for, is there any LVH? Or, is there any heart failure? Because that's a good reason to have palpitations. And then I'm always thinking about the root causes. So I'm thinking about Wolff-Parkinson's white, and I'm thinking about AFib. I'm thinking about VTAC. I'm thinking about, are there palpitations because their heart's ischemic? And that's why they're having ectopy, is they have acute coronary syndrome or underlying CAD. Do they have PVCs, PACs? And I'm always thinking about sleep apnea. Now, this is a great tool that is FDA approved. It's called Kardea. It's an app you can purchase. Well, actually, the app is free on your phone, and you can purchase this plate. You can get it through the app on Amazon, anywhere you want, pretty much for $99. And it can attach to your phone, or it can stay in your purse if you don't want it to be conspicuous, or maybe in your car, for example, if you don't have a purse, if you're a male. And you can take this plate out, hit record, open the app, hit record, and put your fingers on it, just like it's demonstrating here, and it'll capture a little EKG strip. And you can actually save this, and when you come in for a visit, we can look at it and see what you captured when you felt symptoms. You can actually record a little message while it's shooting the image for us and tell us how you were feeling, so we can play the whole thing back. We can hear you, what you're saying, and we can also see your strip. It'll give us a rate, and it'll tell us how good your signal is. There is an option to send it to a cardiologist to have them read. I think it's like $7 or per strip, but there's really no need. If it's not something that's bothering the patient a lot, they can just bring it in on their visit and we can take a look at it. It saves a little journal for us. But one thing to be careful of, though, is it does record what you say, and that was a little embarrassing when the patient didn't know that, and they brought in the strip, and they were having a good conversation. I'll just leave it at that. So always remind your patient, hey, when this is recording a strip, it may be recording your voice. Okay, so next time we're going to talk about syncope, but thank you for joining me on this Palpitations Minute for behind the scenes. If you want more information, or you want to do any online virtual tutoring, you can go to jcarlquist.com, and have a great day.